Hello, hello. Dr. Clif here, coming to you from Juno Beach, Florida. We had another question about the gym. This was a interesting one. It said, is there anybody that should not work out with weights? And the shortest question is probably no, nobody should not work out with weights. But the longer, more complex answer is that there's a lot of people that the answer is it depends. So people that shouldn't work out with weights, let's assume that everybody could benefit. Then going with that assumption, people that shouldn't work out with weights are people that hate working out with weights. If it's so unenjoyable that you won't do it regularly, you're not going to get much of a benefit. So those people would be better off doing some other type of training that will still help to increase their strength and their conditioning and their bone mass and all these other things we're looking for. So if you hate doing anything inside, including weightlifting, but you love doing things in nature, then something like kayaking or rock climbing is still going to build strength throughout your body, but it doesn't involve weightlifting then. That's fine. You just want to be active. Other people, if you have somebody that just had a major injury or major surgery, they're probably going to be missing the gym for a while. They're good candidates to lift weights long term, but short term, they probably need to do something a little less strenuous just to let their body heal. There's people that have severe high blood pressure. That's kind of a gray area, and you really want to be monitored by your physician, and probably if you have access, which unfortunately is in small locations, but it would be best if you went to what we call a MOG, M-O-G, medically oriented gym. So you would go to a gym where they have either very skilled trainers or even like nurse practitioners or physical therapists that are there while you're working out, and they take your blood pressure and your other vital signs fairly regularly to make sure that nothing's way out of whack. But if your blood pressure is fairly controlled, even if it's high, but you know where it's at, then weightlifting can actually be a positive for you. There's a lot of medical conditions that fall in that same category where it's not a red flag, but it's more kind of a orangish flag, where it's not disallowed, but you just have to be cautious. People with diabetes that's not the most controlled, people with certain neurological symptoms. If you have seizures on a regular basis, working out can be real good for you. But going to a mainstream big box gym and working out alone could be a safety issue for you or other people. You don't want to have a seizure when you're holding, 50 pounds over your head. So that could be something that is a little questionable. I think those are probably the main things that come to mind right away. There's always something that maybe weightlifting isn't ideal for you, but there's so many other things that people would use as an excuse to not lift weights, and they could really benefit from it. If you're unsure about that, you can go online, and none of the main sites come to mind right now, but I follow some of them. If you just Google like adaptive athletes, you'll find people with like one arm or one leg that are lifting way more weights than most people that are able-bodied and have all their extremities. So there's people that do amazing things because they don't come up with a bunch of reasons why they can't lift weights.
Assuming you don't have a medical condition and you're moderately healthy, what do you see as the main benefits of a strength training program or a weightlifting program?
I think the clearest and easiest to see benefit for most people is that you increase your strength. And strength is the most important, in my opinion, foundational pattern as far as things that people have physically. So you have strength, you have endurance, you have flexibility, you have balance. There's a few other ones that aren't quite as high up the list, but those four main ones to start with, and then there's things like agility and speed that build off of that. The strength aspect is more important and easier in most cases to improve, although it can take a longer time frame. It's very straightforward to take a 5 or 10 pound weight and pick it up and put it down, and then the next week take a 15 pound weight and pick it up and put it down, and over a year or two suddenly your 5 pound weight is a 100 pound weight, and it transforms your whole body as far as how strong it is, which then makes all kinds of daily activities, whether it's getting off the toilet or whether it's carrying giant packages of groceries at Costco, or all kinds of just normal daily things you do, or more uncommon, not so daily things like going on vacation and wanting to go on some kind of long hiking trip, or wanting to go skydiving, or all kinds of things. The more strength you have, the easier those activities are to do. Even with older people, and it doesn't have to be older people, but commonly older people that have balance problems, a big component of their balance issue is strength. They can tell where they are and they start to lose their balance, and they just don't have the strength to keep themselves from falling. So strength is the number one thing I think that's easy to see. Also, for a lot of people, it really improves their confidence. They just feel better by lifting. Physically, you also have an improvement in bone density, which, especially for women and actually a growing number of men, osteoporosis and falling and breaking bones is a real concern. So bone density is another thing that's improved with lifting. You don't really improve bone density swimming in the pool. You can get in better shape, definitely. Swimming is a strenuous exercise, but you need some kind of weight-bearing exercise, and the more weight that you're dealing with, the more your body decides to increase the bone density. There's also a tremendous amount of improvement in cardiovascular factors that really are underrated, especially if you do some type of weightlifting program that causes you to be stressed, we'll say. So if your rest intervals are low enough versus your work intervals, and you're using a fairly large weight that's you're moving through multiple positions, big traditional weightlifting motions like squats or overhead press or deadlifts, where a lot of muscles are working at the same time, it can be a cardiovascular training scenario, because you will definitely notice quickly that you're breathing pretty hard. There's a lot of workouts we do here that people are tremendously out of breath, like they just ran a 400-meter dash or something, and everything is done in a pretty small area in the gym with weights only. maybe occasionally some jumping up and down, but mostly just lifting weights, and they're completely out of breath. I think those are the main factors. I'm sure there's multiple other ones that I'm not even mentioning that don't come to mind right now, but there's almost every main health marker can be improved with strength training.
As I get stronger, you were mentioning sort of strength being an issue connected with balance for older people. Will it help my balance as a younger person? Will it help my injury proneness? Will it help my sports performance?
Sports performance, it definitely will help. The activities just become much easier when you're stronger, so you don't have to strain as much or work at as high of a percentage of your maximum to do different things like run or jump or change position. And you also don't get as fatigued because you're working at a lower level of your capacity later in a game. If you're playing, like an hour-long match, football, basketball, whatever, or if you're doing even a shorter thing, like wrestling or boxing or something, you're exerting much less to do the same amount. So later in the event, you are more likely to be in a better position compared to your opponent because of that. As far as injury proneness, maybe. I don't know. Some people just seem naturally not so coordinated, and you can be really strong and still have bad balance, or you can be really weak and have bad balance. Some of that, I think, is some people just don't really pay attention to where they're going. They're kind of distractible all the time. Another big factor there is how well your nervous system is talking to your body. You have little nerve receptors in your skin, like in your feet, we'll say, that give you feedback of where your foot is. Some people's just don't work quite as well, especially if you have something like diabetes or something. You hear people talk about neuropathy, and a lot of times neuropathy can be very painful because they're getting... Neuropathy is kind of a jumbled messages from the nerves in a certain area, which happens to diabetics. It can happen to people that have certain types of chemical poisoning. It can happen because of cardiovascular issues. There's a bunch of different types of neuropathy, but one of the more common ones is diabetic, because diabetes is a growing epidemic in the United States and really in other parts of the world too. So with diabetic neuropathy, you can have a lot of pain. Not everybody does, fortunately, but unfortunately a lot of people do. But also the messages from your foot to your brain don't come through so well. So that can make your balance off when it feels like you're walking on a bunch of river rocks all the time because of your neuropathy. Your balance isn't going to be very good. Now, could it be improved slightly because you're stronger? Yes, because it's more work to stay balanced when you feel unbalanced all the time, but as we said before, if you're stronger, then the amount of work you're doing is less. The other type of scenario that can cause some balance issues is that you have a separate set of little nerve fibers that are inside each joint. So if you have a knee replacement, or if you're a younger person in your teens or 20s and you've sprained your ankle 100 times, let's say, you played a lot of basketball, or you were a dancer or something where there was just a ton of stress on your ankle all the time, and you have one ankle that's like, oh yeah, I sprained that ankle like every month for years. You've damaged some of the little receptors in that joint, or in the case of a replacement, all those receptors are just gone because they took the joint out and put a titanium one in there. So you don't get as many messages from that area, and the body has to figure out how to use the rest of the joints that are still working normally to kind of just extrapolate from that and figure out where that joint is. So that can make balance a little more difficult. Okay, I think those are all the questions we have for today. So if you like this video, don't forget to give us a like. Leave some comments below if you have any comments or questions about the video. And don't forget to subscribe if you like this information, because we are here weekly giving you updates on any health and fitness topics. Thank you.